next presenter, Bonafacio Magitbay, or Bonnie as he's known by friends around the world, is from the Philippines. He's currently the technical officer of the World Health Organization based in Geneva, Switzerland. His background is one of civil engineering and environmental and sanitary engineering and environmental management. Bonnie has more than 20 years experience in water and sanitation projects in Asian countries. Currently, he's working on what's called the Vision for the Network that helps build partnerships, advocacy, research, evaluation, and other strategic initiatives. Mabuti, or welcome, Bonnie.
Thank you, Charles, for your kind introduction. Good morning, everyone. Okay. We are here today with one purpose, isn't it? To talk about water. Water, as we know, is considered as the universal solvent because it dissolves almost everything. Our body is about 60 to 70% water, and we know that without water, there will be no life. I will introduce and share with you today an example of collaboration, the network that is collaborating for water, an initiative of WHO to improve health and enhance the life of men. I'll be discussing 6 major points in order to orient you on what the collaboration in WHO for the network is doing. The historical background on how we came about with the network itself, what's being done, the progress so far, our accomplishments so far, what are the big remaining challenges for the network, our future direction, and how the Rotarians can collaborate for the work of the network. The initiative to start collaboration for the network started in 2003 because during that time, WHO prepared a burden of disease analysis, and we found out that about 6% of the global burden of disease is related to water, sanitation, and hygiene. And during that time, still 1.1 billion of the population lacks still access to safe water. And even though there are plenty of players helping the water and sanitation sector, they are still fragmented. The efforts are still divided in addressing the issue of safe water. However, there are a lot of opportunities still available during that time. There are lots of researches available saying that household-based water management or household water treatment and safe storage are very effective. And there are active key players that are willing to collaborate in order to reduce these waterborne diseases. And also during that time, public-private partnership or public-private collaboration is an accepted United Nations or WHO strategy to implement a project or program on water and sanitation, as an example. There are also existing models of collaboration under the WHO setup, like, for example, collaboration for the TB program, polio, AIDS, malaria, and others. So, during that year, 2003, WHO initiated a workshop in order to set up what is the possible model for collaboration. There are several criteria that were considered. One is that model should be building on partners' competitive advantages. That model should have at least light administrative structure, not too heavy, not too formal. And its governance is flexible, meaning you can touch it anytime you want. It can start quickly, and it can evolve incrementally. So, based on those criteria, we agreed that the network is the best model that we can use for collaboration because the network model can be a forum of cooperation, communication, and coordination to address a common goal. The network can also be an information clearinghouse, and the network can be a vehicle for promoting new knowledge on household water treatment and safe storage. In year 2003, there were about 20 agencies who formed the network. And as of now, as you can see there, It's about 120 at present. So it evolved, the membership evolved over time of only about 5 years. So we increased from 20 to 120 in 5 years' time. And you can see the proportion and the category of members. We have the strongest one are the NGOs, which is almost 45%. Next is the private sector, 17%. The government, 13%. Academic institutions, 15%. Governments, 13%. International organizations, 6%. And professional associations, 4%. So based from this membership, we can say that this approach is very attractive to NGOs. It's very easy to explain that because this approach, HWT, is very easy to implement. And it can provide results immediately. Ooh. That's the technical technology. Can I be back that? The mission. All right. Now, as I've mentioned, one of the criteria or one of the reasons why selecting the network model is that we can have a common goal. And that's one of the mission, or that's the mission of the network. We'd like to contribute in the reduction of waterborne disease because we know it was discussed by the previous speaker that we have around how many deaths or how many million deaths do we have in 1 year or annual. Some speakers said it's about 1.8 million, so we'd like to reduce that significantly. And how do the network do that? The network is not an implementer. We cannot right away or directly reduce those diseases. So we can do that by promoting household water treatment and safe storage to be a component of water, sanitation, and hygiene programs. So a small input, but we are thinking of a big output. Much like a very ambitious mission. So how to do that? We strategize to form 4 working groups. So we have an advocacy working group, communication, research, and implementation. And you can see there that collaboration within the working group and among the working groups are happening in the network. So what are the activities or the objectives of each working group? For advocacy, our objective here is to promote the household water treatment and safe storage as part of policies, programs, strategies, activities, or intervention for disease reduction at different levels, not only at the national, but also at the regional and at global levels. So we'd like to target the policy of all key stakeholders. These expected outputs are, some of these are process outputs, some are outcomes. We are targeting to have advocacy tool, which already we accomplished that, and we would like to engage in different policy discussions at different levels for household water treatment. For communication, what are we going to communicate? Mark already mentioned and Rob already mentioned some research results, and those research results are part of our communication or information content. And we are doing that by disseminating information through our website. We have already established our website, newsletter, developing household water treatment, facts and figures, and developing a network of directory of the network members so that we can regularly update them about this information. Research. Our objective there is to evaluate the effectiveness or efficacy of cost effectiveness, the health impact, acceptability, affordability, and scalability of the interventions. And I think a portion of this was presented by Mark and also Rob. What are our expected outputs for this working group? The critical knowledge gaps. Are there still knowledge gaps in the information? Research agenda. What are we going to research? And the available technology, is it effective? Is it scalable? Are we happy with those technologies that we have as compared to the WHO criteria? So these things are the ones we'd like to do. With regards to implementation, what are we going to do as part of the working group. In our mind, we'd like to improve the water sources of the population. As previously mentioned, we have about 1.1 billion who lack access to safe water. But it doesn't mean that's the only problem. 1.1 billion has no access, yes. They are drinking from any source that are unsafe. But those that we know that are sourcing their water from the safe source, there is also a problem of recontamination, and they are also at risk. So they can be also a problem. So how to address those things? We would like to advocate that they implement this household water treatment system. We would like to aid them or assist them by providing some guidelines on how to implement those the technologies that we are promoting. What are the initial activities that we did in the past years? We already developed a 5-year strategic plan, 2003 and up to 2008. So this year is the end of that strategic plan, and we are planning to develop a new one. We have created the 4 working groups. We have established a network website. So you can click that link to see what are the contents of that website. We have conducted several country meetings in different countries: Cambodia, Kenya, Bangladesh, Ethiopia, and the latest one is in the Philippines. We are planning to conduct next country meeting in Indonesia. The Ghana one is an international meeting, but we'd like to also to include a country meeting in that meeting in June that we are planning. Household water treatment has also been included in some international fora, like the World Water Forum in Mexico, IWA conference in Beijing, WEDI conference in Sri Lanka, World Water Week in Stockholm, Techno Workshop in Berlin, Small Community Network meeting in UK. So it seems that the household water treatment system is becoming popular in the international discussion, and we are happy about it. We have this publication. I'm not sure if you have seen this, but some of the members of the network were sent this publication. It summarizes all the household water treatment technologies that we are promoting and the strategies that we are doing for the network. You can download this from that website. All right, as I mentioned, we have the research agenda also in the website. We have some fact sheets already developed, newsletters, household water treatment system guide during the tsunami. We develop country fact sheet templates so that any country who would like to develop a program for household water treatment can start from that country fact sheet to determine what are the status of the country and what interventions are appropriate, what technology is appropriate. We have seen a while ago series or about 4 or 5 or 6 technologies being promoted for household water treatment. Which one is appropriate for a country? In Ethiopia, might be different from Cambodia. Cambodia could be ceramic filter, while Ethiopia could be bison filter. Depends on the availability of local materials and other factors. Next is the partnership with UNICEF in the conduct of country meetings in priority countries. Only this year, we had an agreement with UNICEF, not a formal one, that we can conduct country meetings on their priority countries. They gave us a list of about 60 countries. That's quite a large number of countries. And we are very ambitious to conduct country meetings almost a month. And that will, it surprised us that UNICEF is really very willing to support the household water treatment system. In the previous years, we are conducting only about 1 or 2 meetings, country meetings a year. And now they are saying at least once a month, which is a good sign that some donors are now acknowledging household water treatment as an intervention. If we will wait for the big infrastructure project, as previously discussed, it may take about 5 to 10 years. But as you can see, the statistics, daily about 5,000 children is dying. Can we wait for 10 years? How many deaths will be saved if we can start now using these technologies? So far, we have still uncompleted work. We are still doing this. We are finalizing the network directory. It's really very difficult to complete this because the increase in number of membership is really too many, and the Secretariat has difficulty in completing it. The photo library, we will be requesting members to submit some ideal photos so that we can post that in the website. The environmental technology verification guidelines that will say which technology is really acceptable. Global mapping and monitoring of household water treatment and safe storage activities. We don't know who are doing what in different countries at the moment. Maybe in some countries that we have strong partnerships, yes, you know. But within that country, you don't know other NGOs doing the same thing. So we'd like to monitor that. We'd like also to develop household tests for fecal contamination. How would we know that your water is safe using low-cost treatment, or low-cost testing kit? So we are also doing that. We would like to publish another publication as a sequel of those combating waterborne disease, and that's managing water in the home and other topics included there, like cost and cost effectiveness, and also how to scale up household water treatment and others. And the toolkit for implementation, like how to implement a technology and how to monitor the technology. As I mentioned, the challenge is still big. 1.1 billion, 7% is still using unprotected water source, and 5.3 billion is under the risk of recontamination. And about 1.8 million deaths per year due to diarrhea. Very few countries have policies on household water treatment, and there is an increasing demand for some NGOs to be member of the network, and the Secretariat is now overwhelmed with that demand. Now, in order to address some of the issues that I've mentioned, what will be the future directions of the network? From 2003 to 2007, we have these 5 major chunks of activity: institutional membership, advocacy and communication, development of tools and guidelines, research and development, conduct of symposia, and country meetings. For the next phase, we are thinking of improving these chunks of activities. We are not eliminating these activities. These are good foundations. But we would like to expand these activities because of the increasing number of members who are interested to implement household water treatment system, and also our goal and our drive to reduce waterborne diseases at a faster rate. So we'd like to check on the network governance, linkages with other sectors, improving the institutional capacity setup, further improving the technology evaluation development, conducting more country planning and monitoring. So I can still discuss in detail some of this item. All right, network governance. At present, the governance is very simple, as I've mentioned. Network has a very simple governance, very light administrative structure. There is only one secretariat, and that's all, and other are members. But since we are now more than 100, we are thinking of establishing advisors so that they will guide the secretariat and the members on what will be the direction and policies that we are going to take. Like, for example, are we going to accept this member? Or are we going to prioritize countries? Which countries to prioritize to implement? So the Secretariat cannot decide on that immediately if we would like to implement immediately. So we need advisors. The working groups or committees can still be there, but we can improve their function. Since we are increasing in number, we are thinking of having a membership and awards committee. There are probably good performers already, champions in different countries, so we need to recognize them so that they can be an advocate, they can be a useful champion for HWTS. Also, there are some demands. I received some requests for individual professionals to be member of the network. At present, the policy is only institutional members are accepted. So individual members are not yet. Students are not yet. So and they are potential resources. So why deny their request to be members of the network? And we are still thinking on how to do that. Advocacy and communication will still be there. Institutional capacity building, we need to train some people, NGOs who are interested that are not yet familiar with this. So these things are in the priority list that we will be doing. Research, evaluation, technology development, planning and implementation, and of course the secretariat still be there. Linkages with other sectors. So we have several sectors that we're planning to link with. The water sanitation hygiene program, the bigger one. Other sectors like health education and emergencies. Linkages with other donors, aside from UNICEF. Initiating dialogue with a joint monitoring program of WHO and UNICEF, because that's another sector in our group, to include household water treatment in the joint monitoring program count, in the MDG count. There are still existing debate that household water treatment system could not be included in the count because of some issues. So we are still ironing that out. Learning institutions, we can include HWTS in their engineering curriculum, for example, so that the effect will be sustainable. Regulatory network. This new network was established by WHO in order to guide countries in developing policies on water. And the household water network is one of the network that has some outputs related to water. So we will link to that network. And also a small community water supply network. These are the pipe water system. So we are planning to link that so that if they would like to know more information on the household water treatment system, we can advise them on what to do. And so on. Institutional capacity building. So identification of global HWTS reference centers, regional hubs on household water treatment system, advocacy for inclusion in curriculum, I already mentioned. Technology evaluation. There are other contaminants aside from bacteria. We have arsenic, fluoride, nitrate, iron. Are there available technologies now? Or do we need to develop more? Scientific evidence for indigenous technologies. There are some local technologies that we don't know the effectiveness or the efficiency of that, whether it can remove bacteria or what percentage of bacteria will be removed. Safe storage technology is very rare. We have very few options. Performance improvement of existing technologies. I think this is being done for biosan filter and other technologies. Country planning and monitoring, country needs assessment, I already mentioned. Mapping of implementers and technologies at the country level. Monitoring schemes to be linked to the joint monitoring program on water and sanitation. Now this is my last slide. What are the possible collaboration opportunities for the Rotarians? As I have already mentioned several activities of the network, and these are the things that I think we can collaborate. As I've mentioned several 4 or 5 working groups or committees, so perhaps if you are interested, you can join in participating in one of those committees. We are planning to conduct country meetings and workshops in different countries. So in areas where you are operating, we can coordinate, and perhaps you can also support participants that you are assisting that country to join the network at the country level. You can also support international resource speakers in country workshops, because the design is some country workshops will invite international speakers to tell the global picture on household water treatment system. So if you would like to support some international speakers that you know, you can assist us on that. And you can also support the secretariat in resource mobilization so that the network can move on. Because at present, the support from the house of the network, the funding support of the network comes from other partners also of the network. WHO is allocating a little portion of our budget for the operation of the network, but most of the budget comes from the partners. So if you can assist us in this, doesn't mean that you will support WHO. It could be you can support the activities of WHO, of the countries in conducting those activities. I think that's all, and thank you and good day.